Welcome all. We'll give this a minute to let folks sign in. Welcome everyone. We'll get underway in just a moment. We'll just give another few seconds for folks to sign in and join us. Good evening, folks. My name is Joe McCartan. I'm the Executive Director of the Kalmanovitz Initiative for Labor and the Working Poor at Georgetown University. It's my pleasure to welcome you to tonight's special program. The Kalmanovitz Initiative was founded in 2009. Its mission is to seek to understand and address the problems that afflict working people. To learn more about our work, I encourage you to check out our website at lwp.georgetown.edu. Today's event grows out of a collaboration that the Kalmanovitz Initiative began in March 2020 with our Georgetown colleagues, Dr. Rosemary Sokas, a renowned expert on occupational health and safety, and John Monahan, the interim Georgetown University School of Nursing and Health Studies interim dean. At the outset of COVID, Rosemary and John and I began convening experts in occupational safety and health, labor unions, worker centers, policy advocates, and others to monitor COVID's impact on workers and to strategize about responses to it. Those meetings were coordinated by Lily Ryan, who is also working behind the scenes to coordinate tonight's webinar. Quickly realized that COVID-19 was likely to be the single most dangerous workplace safety crisis we've seen since the passage of the Occupational Safety and Health Act back in the 1970s. And one of the first people we turned to in March of 2020 to help us understand COVID's impact and what needed to be done about it is tonight's presenter, Debbie Berkowitz, who served as Chief of Staff and as Senior Policy Advisor at OSHA during the Obama years, 2009 to 2015. We all realized that Debbie had a grasp of the issue, a sense of what needed to address it, and the know-how, the experience, and the ability that allowed her to rattle into action. She sprang into action in 2020 and helped lead campaigns for stronger state and federal standards to protect workers from COVID-19. Her skill in doing that was honed over a rich career dedicated to the cause of fighting for worker safety and health. Prior to working at OSHA, Debbie was the Health and Safety Director of the United Food and Commercial Workers and the Health and Safety Director of the Food and Allied Services Trades Department of the AFL-CIO. After working at OSHA, Debbie served as the Worker Safety and Health Program Director at the National Employment Law Project for 6 years, collaborating with national and state partners to develop successful policies and campaigns that improved conditions for vulnerable low-wage workers. She's the author of widely cited reports and research on model policies to improve worker safety and worker compensation systems. She's testified before congressional and state legislative committee hearings, most recently in late October before Representative Clyburn's Select Committee on COVID. Her writing has been published in the Washington Post, Bloomberg, BNA, Workers' Compensation, Quartz, The Hill, and many other outlets. She's a recipient of numerous awards, including the American Public Health Association's Alice Hamilton Award. More importantly for us here at KI, after she decided to retire from her work at the National Employment Law Project, she consented to join us as a practitioner fellow, helping our initiative to address the urgent problems of worker safety. And no problem is more urgent right now than COVID. It's prompted action recently from the Biden administration. As we all know, last week, OSHA announced a sweeping emergency temporary standard to address that threat. As we know, over the weekend, federal judges in the Fifth Circuit have stayed enforcement of that order. But as we await its legal fate, we wanted to have an opportunity to clarify what it does, what it doesn't do, and what makes it such an important development, what we all should know about it. To help clarify all of this for us, we're really proud to now turn to our wonderful new colleague, Debbie Berkowitz. Debbie?
Thank you, Joe. And I'm like completely honored to be a fellow at the Kalmanovitz Initiative, and it's been great. So I think I'll get right into the program, and I'm going to give an overview, and then please put questions in the chat, and we'll get to them, as many as we can. I thought the webinar is about what OSHA did on Thursday, this new OSHA emergency temporary standard, which was issued last Thursday and has a temporary, hopefully stay on Saturday. But I thought I would start with just some context so you understand how OSHA got here and why they did this. So, you know, COVID-19 is not only a public health crisis, it is the single largest occupational health crisis since OSHA was created in 1970. Workplace exposures and the lack of mitigation measures implemented by employers resulted in workplace exposures and workplace COVID cases becoming a significant driver of the pandemic. As Joe mentioned, just 2 weeks ago, I testified in front of Representative Clyburn's Select Committee on COVID with other allies about the exposures and the sickness and illness and death in meat and poultry workers from COVID. And one thing was clear, just from the very 4 or 5 months at the beginning of the pandemic, 1,000 workers in a facility got sick because of the lack of effective mitigation measures implemented by the company. And then workers brought that exposure out into the community, where the communities around meat plants in rural America had COVID rates 10 times as high as other communities that were not surrounding meat plants. And the evidence was clear back in the spring of 2020, how to mitigate the spread of COVID-19 in the workplace. CDC put these guidelines right up on their website at the end of February, in March, at the beginning of April 2020, and said it's about social distancing, it's about face masks, it's about better ventilation, keeping sick workers out of the workplace. It was about contact tracing. And but OSHA did not set any specific requirements for employers to meet. Their CDC guidance is just guidance. It's a guideline. You can follow it or you can ignore it. And lots of employers followed it, but lots of employers, in fact, entire industries ignored it. So OSHA is the agency that establishes workers' rights to a safe workplace. OSHA is the agency that requires employers to protect workers on the job. There is no other agency that does that. And they're used to regulating things like infectious diseases. one of the OSHA standards that had the greatest impact that was issued in the early 90s was the standard to protect workers from getting AIDS and Hep B on the job, another infectious disease. But OSHA did not have any standards for airborne infectious disease because COVID-19 is spread through small droplets and large droplets, through breathing, through talking, through singing. And OSHA didn't have any specific requirements on the books for something like this that was so deadly. Way back in the spring of 2020, the AFL-CIO petitioned the last administration to write an emergency temporary standard to protect all workers from COVID-19 in the workplace, just implement the basic CDC guidance. But the last administration refused. They just said they're not doing that. They're going to let employers voluntarily figure out how to protect workers, and that's what they're going to do. I want to make it clear that there were 13 states that did implement some protective measures, but that's just 13 out of 50 states, and some were better than others. And so there was a little bit of a patchwork, and in many states, there were no requirements. And I hate to revisit this nightmare, but during the Trump administration, over 13,000 complaints were filed by workers or their relatives or their representatives to OSHA about COVID-19 hazards in the workplace. And in almost every single case, OSHA did not do an inspection. They just emailed the employer and they shut the case. And workers had nowhere else to turn. There is no private right of action under OSHA. Workers cannot sue to get their OSHA rights enforced because the OSHA law says very clearly that employers have an obligation to provide a workplace free of recognized hazards that can cause serious physical harm or death. And COVID clearly was causing serious physical harm and death. So it's clear that had OSHA done something back in April or May of 2020, we'd be in a different situation right now with, the extent of COVID and COVID deaths and hospitalizations, not only among workers, but in the entire population. Had OSHA done enforcement, there had been a whole lot less cases in a lot of industries among meat and poultry workers, supermarket workers, warehouse workers, and you can go on all the workers that went out to work from their homes so that we could all stay at home. So now you fast forward to January, the Biden administration is sworn in, and the day after Biden is sworn in, he issues an executive order that says that OSHA should, if they want to, write an emergency temporary standard to protect workers from the spread of COVID in the workplace. And so OSHA gets to work. Now, many of you, or maybe some of you know that it usually takes OSHA 7 to 15 years to write a standard. And that's because the OSHA law is quite weak. And over the years, the Supreme Court has given OSHA a number of different steps that they have to take. And there's a great graph on OSHA's website under standards and regulation that shows like how many things they have to do to issue a regulation. But the OSHA law also realized there could be a hazard that is so grave and so new that OSHA cannot take all these years to write a standard. And so the law actually said that OSHA could write an emergency temporary standard. And what it says is they can do it quickly if they find that employees are exposed to grave danger from exposure to substances or agents determined to be toxic or physically harmful or from new hazards. This provision was clearly made for COVID-19. It's a new hazard and presented a grave danger to workers working outside the home. Just another example from meat and poultry, because that's sort of a lot of the work that I've done, but more meat and poultry workers died from COVID-19 in the first year of the pandemic than died from all other work-related causes. And that's work-related COVID, than all other work-related causes. And this is a dangerous industry in the past 15 years. So OSHA did what the president said on the executive order and drafted 2 drafts of an emergency temporary standard, one for healthcare workers and one for everybody else working outside the home. But only one of those standards ended up getting published this past June. This past June, OSHA published the first of its COVID emergency temporary standards to protect healthcare workers from COVID-19. And this was a really big deal because the last time OSHA had issued an emergency temporary standard was in the 80s. So it's been a long time since OSHA has used this clause in the law, to write anything. I mean, it's rarely used. And when OSHA uses it, it's because there's really a grave danger. That standard is upheld. It was contested by some unions who thought it wasn't strong enough, and it's been in place since June. And, to be fair, California has its own state OSHA, which I will explain, federal OSHA, state OSHA, but they've actually had for a decade a standard to protect healthcare workers from airborne infectious agents, like one could be like COVID. And so OSHA borrowed from an existing template that we knew was feasible and workable when they put the OSHA ETS for healthcare workers in place. And that standard, if you don't know, and I'm happy to answer questions about it, covers all healthcare workers, including home care workers that work for an agency inside someone's home. And it covers all workers in a hospital, not just the nurses and the doctors, and workers in other facilities that, where they're providing, healthcare services. And it provides for, like, if you're in a hospital, you have to triage patients in a way so that suspected or infectious patients are, minimize the contact with workers. Any employee that will have anything to do with a suspected or confirmed COVID infectious patient has to wear a respirator. A respirator is an N95 or something more. Face masks are not respirators, they're face masks. It does require face masks for other workers. It requires social distancing. It requires training, requires ventilation. And also, if a healthcare worker gets sick with COVID, it says, they need to stay home until, they get better and follow the CDC guidelines for when they can return to work. And the company has to pay them their regular rate of pay when they are sick. And that's called medical removal protection. So therefore, it takes away the incentive for a sick worker to keep working because they have to pay a bill. But then sick workers, as you know, with COVID, the hazard are sick workers and infectious workers that spread it, and you want to get those workers out of the workplace. So, this was a great thing. It was a long time in coming. It may not have been perfect. OSHA standards are always a minimum, and I'll say that over and over again. But they did publish that standard, and it does cover all healthcare workers, but it does not cover workers like in retail or warehouses or food processing or meat and poultry plants or supermarkets, or there were still no requirements for social distancing or masks or, ventilation or keeping sick workers out of facility. But then the vaccine sort of was accessible for people by then, by June, and there was a big push to get people vaccinated. Unions, employers, everybody was trying to get workers vaccinated. And then the Delta variant hit. And it turns out that many individuals decided not to take the vaccine, some because they were working 6 days a week and they couldn't get access to it. It wasn't easy. Some because they believed some false and spurious information about vaccines and the safety of vaccines. Others, some had medical reasons, some had religious reasons. And COVID started spreading again outside of healthcare. The Delta variant started spreading. In fact, I worked very closely with meat and poultry plants. Locals were filing complaints. Sick workers are being brought back into the workplace. And we had, and the numbers, we started having 2,000 people die every day again of COVID. The numbers are rising. It's very scary. So in September, the president said to OSHA, you need now to issue another emergency temporary standard. It won't cover the healthcare workers that were already covered by the first emergency temporary standard. But it'd be another emergency temporary standard. And this is what the president executive order said. It said it would require all employers with 100 or more employees to ensure that their workforce is fully vaccinated, or require any unvaccinated workers who remain unvaccinated to produce a negative test result on at least a weekly basis before coming to work. This would cover over 80 million private sector workers, and in states with state plans, which I'm going to talk about, cover their public sector workers. Further, the president said that the OSHA ETS, and this is precedent setting in a way, will ensure that no worker loses $1 of pay because they get vaccinated. Some other standards have this thing called medical removal protection, but in this standard, the new rule that OSHA is developing, the president said, will require that employees are paid time off to get the vaccine, both doses if they're going for one with 2 doses, and paid time off if they get a reaction or a side effect. So 6 weeks roughly after the president's executive order, OSHA, really amazingly, wrote this new standard and published it last Thursday. It hews very closely to what the president said. It is a worker safety standard to protect workers from getting COVID while on the job through making sure that potentially infectious workers do not enter the workplace. That is how it works. The ETS is not a vaccine mandate. It is a requirement to keep the workplace safe from the hazards of potentially infectious workers through testing or vaccines. And this is what the preamble states. And I want to read this because there's so much misinformation out there. OSHA has determined that an emergency temporary standard is necessary to protect unvaccinated workers from the risks of contracting COVID-19 at work, when a simple measure, vaccination, can largely prevent those deaths and illnesses. The emergency temporary standard protects these workers through the most effective and efficient control available, vaccination, and further protects workers who remain unvaccinated through required regular testing, use of face coverings, and removal of all infected workers from the workplaces. There are some great things in this new emergency temporary standard, and some of them that have, raised some bells. Everybody always, I've been doing this work now for, over 40 years. Whenever OSHA issues a standard, a lot of us are like, I wish it had gone farther. And then, of course, industry contests every single OSHA health and safety standard there ever has been. I want you to know that they've all been upheld, and only one that I know of in the history of OSHA has been stayed like this current standard, and that was in the late 70s, and that was the lead standard, and that was on a feasibility issue. So, there are 27 states that have filed suit against OSHA, and including the group behind the lawsuit where the Fifth Circuit allowed a sort of temporary stay of the rule is the Liberty Justice Center, which are the same folks that brought us, for those in the labor movement, Janus versus AFSCME. They brought the case to weaken public sector unions so that workers don't have to pay dues to unions. So they have a long history of weakening labor rights. But let me go over what the standard says, and then we'll open it to questions. It covers all employers in the private sector with more than 100 employees. In the 25 states with state OSHA agencies, so in the sausage making in the 1970, Nixon signed the OSHA law. When the OSHA law was created, they allowed states to take over enforcement of OSHA if they wanted to. They have to pay half, and federal OSHA pay the other half. And they have to assure that their state plan offers standards and enforcement that offer that the protection is as effective as federal OSHA. So in those states with state plans, those states, this OSHA standard, they have to adopt it. It will also cover their public sector workers, because state plan OSHAs cover the local and state employees. The 29 states that have federal OSHA, and under federal OSHA, their public employees are not covered. This new standard does not cover anybody covered by the previous OSHA ETS, the healthcare standard. It also says it doesn't cover workers who work exclusively outdoors. However, if you're like a farm worker or an agriculture worker and you ride a company van to work with other people, you will be covered. Or if you're an agriculture worker and you go indoors for part of your job, or you eat lunch indoors, you will be covered. It's really that you spend almost all your time outside, except for maybe going to the bathroom. It also doesn't cover workers who are covered by the federal contractor, subcontractor rules that have been implemented that require vaccine of federal contractors and subcontractors. Just as an outside, I want to repeat again that OSHA standards are a minimum. They are a floor. They are a floor. And in fact, through the preamble, OSHA says continuously that companies can do a whole lot more than this to protect workers, but at least this is the floor. They have to do this. OSHA says clearly vaccination coverage remains the most effective means to achieve control of the pandemic. I want to let you know, despite what you've heard, the standard's only 4 pages and that the preamble is 150 pages. And that's really the preamble is what OSHA uses to defend itself against lawsuits. So it's good that they have a lot in there because 27 states have brought a lawsuit. So this, in a nutshell, is what the standard requires. The employer must establish, implement, and enforce a written mandatory vaccination policy. However, the employer is exempted from that requirement that I just read if the employer establishes, implements, and enforce a written policy allowing any employee not subject to a mandatory vaccination policy to choose to be fully vaccinated against COVID-19 or provide proof of regular testing for COVID-19. That's the language from the standard. So essentially, companies can have a vaccine mandate, or they can have a mandate that says you have to be vaccinated or you have to be tested weekly. And so the employer, could put in a mandatory vaccine policy under the standard, or a policy that allows an employee to choose between a vaccine or weekly testing, and those that are not vaccinated also have to wear a face mask. In either case, anybody that's vaccinated, the employer has to keep records of the vaccination status of each employee. They need to know who's vaccinated and who's not. And I know people have asked me this, but it says that the employer must require each vaccinated employee to provide acceptable proof of the vaccine status, including whether they are fully or partially vaccinated. The acceptable proof includes a record of immunization from a healthcare provider or pharmacy, a copy of that COVID-19 vaccination card, a copy of a medical record documenting the vaccine, or a copy of any other official documentation that contains the type of vaccine administered and dates and names of the healthcare professional administering it. It does allow in instances where an employee is unable to produce an acceptable proof, as I just mentioned, the standard allows for some kind of attestation by the employee. The records of vaccines, however, are considered medical records under OSHA standard 1910-20, and they're subject to OSHA's privacy requirements under that, but a worker can ask to see their medical records, or if the worker gives permission to someone like a lawyer or a union person to get their medical records, they can get those records. Also, if an employee is vaccinated before December 4th, which is the deadline for when this written policy has to be in place, the company doesn't have to get any other records than what they already have. A key provision here that, again, is, pretty forward thinking is the employer must support COVID-19 vaccine and provide up to 4 hours of paid time off at the worker's regular rate of pay, including travel time for workers to get vaccinated for both vaccines, and time to recover from side effects reaction. And OSHA says in the standard that could be up to 2 days. And then for testing, for those employees who are not fully vaccinated, they must provide documentation that they have been tested for COVID once a week. The employee must pay for the cost of the testing. If they use the tests that I have, which are the tests that you get at the CVS, your local pharmacy, it's about $10. OSHA says if a worker can't self-administer and self-read the test. They would have to bring the test to the company and let the company see it, or do it at a CVS and have a healthcare professional. So there are some logistical hurdles for the worker to get the test, in addition to having to pay it. And this is unusual in an OSHA standard, that workers bear the cost of some part of their protection. But this is what OSHA says. In this ETS, OSHA has largely required employers to bear the costs of compliance, including the typical costs associated with vaccination. But it has determined that it would not be appropriate to impose on employers any costs associated with COVID-19 testing for employees who choose not to be vaccinated. The ETS is designed to strongly uncover vaccination because vaccination is the most efficient and effective control for protecting unvaccinated workers. COVID-19 testing is only required on the ETS where an employee has an individual choice to forego vaccines and pursue a less protective option. There also may be some Fair Labor Standards Act issues with employees having to pay for testing or time for testing that may be raised. Masks, another point here, the employer must ensure that each employee who's not fully vaccinated must wear a mask, and the employee has to pay for those masks, except if they're alone in a room like this room here, floor to ceiling walls and a door. Again, it's a minimum. OSHA says employers could do a whole lot more. Employers have December 6th to put a plan in to do the vaccine, and January 6th to get the whole testing program in place. Enforcement, federal OSHA is in charge in 29 states. In the state plans, there are 21 states plus another 5 that have state plans. The 5 have it just for public employees, 21 states and Puerto Rico have it for the private sector. They get an additional 30 days to just implement this rule. Now, sometimes states say, we're not doing it. We're not going to implement what you said, OSHA. This happened to us under the Obama administration when I was there. Arizona said, we're not going to adopt the new standard to protect residential construction workers from falls. We're not doing it. And so we cajoled for a bit and talked with them like, no, you have to do this. There's one minimum safety standard for the whole country. You could do better and it could be stronger. And then when they really refused, OSHA moved to start taking over that state plan. And I have to tell you something, employers don't want federal OSHA in their states, in state plans. They love state OSHA agencies because they're pretty universally, not everywhere, but in most states, the enforcement is a whole lot less robust. And so the employers don't want federal OSHA in there. So Arizona eventually backed down. With the OSHA ETS for healthcare, South Carolina, Utah, and Arizona at first said we're not implementing it. And OSHA just moved very quickly to start taking over the plan, or at least taking over enforcement of that standard. And South Carolina has already adopted the standard. So, you can see the lawsuits now. I want to make it clear that there is no army of OSHA inspectors out there to enforce this, that OSHA has already said that if an employer is going to try to comply in good faith, that they're not going to do enforcement, that they won't issue citations. I think OSHA is largely going to rely on voluntary enforcement. The employers have 60 days from now, and then OSHA's and then in state plan states, another 30 days. And OSHA, with any new OSHA standard, OSHA always gives employers sort of some wiggle room in terms of if they're trying to comply, but they haven't quite yet, they will not cite them. So this may have some impact, the standard, on the New York HERO law, which covers COVID right now and airborne infectious disease. New York is a federal OSHA state, and it's very clear in the OSHA law that when federal OSHA issues a standard, that state, because it doesn't have its own state OSHA for the private sector, that is preempted by federal OSHA. And I think the New York HEROes law also says that if federal OSHA moves to regulate in this area, it might be preempted, but we'll have to see, because this is a very narrow vaccine or testing standard, and the New York HERO law is much broader. Other states like California that already have an OSHA ETS, because it's a state plan, they can keep that and add on to it. A lot of people have criticized this standard and wish it did more. it's a minimum, and, but then you've got all the sort of criticism from the right that, we don't really should be in the business of protecting workers at all. So I think I'll just sort of end here and then open the floor, to any questions. So thank you.
Thank you, Debbie. That was a tremendous overview very quickly of all the key elements of this emergency temporary standard. Let me just underline one thing, and while I'm doing that, just invite people to submit their questions. And that is something you said earlier, that only once before has a court intervened to stay the application of an emergency temporary standard, and that was way back in the 70s, and it was on the question not of the authority of OSHA to issue the standard, but simply on the feasibility of it. Is that right?
Right. I have to tell you that, that most of the employers in every case, except just now, the industry that contests OSHA standards is too strong. It's the industry regulated. So it's the Chamber of Commerce or it's the building trades. And I remember way back in the 70s, the vinyl chloride industry, OSHA issued a standard to protect workers from this incredible toxin. They said, we're going to go out of business. You were going to close. It's not feasible. The courts let it go forward. Oh, they saved, not only did the company save money when they corrected the hazard in that they controlled the exposure of the toxic substance, so they didn't let it all go out in the workplace, but it also saved lives. It's sort of what I say, it is OSHA standards don't kill jobs, they prevent jobs from killing workers. But OSHA makes it in the law that standards have to be feasible. The law lays out what a standard, has to do, and the test it has to meet. And so that's a lot of what's laid out in the preamble. The lawsuits right now have nothing to do really with the substance. It's all about OSHA can't do this. They're not allowed to regulate infectious disease. They're not allowed to, this is unconstitutional. They're not allowed to do this kind of protection for workers. I think, OSHA just filed its brief in reaction to the stay in the Fifth Circuit, and it's a really good brief. I recommend people reading it. Can I just add one more thing? I forgot one other important point, and it's not perfect, but OSHA, the new standard also says that once the employer learns that somebody has COVID, they can't come back in the workplace. Now, they're not going to get paid, but we do know in the meat industry, workers who are sick are being incentivized to come back to work, or said, if you don't come back, we're going to fire you. So, I'm hoping that this standard would prevent that from happening.
Well, thank you, Debbie. And we have a lot of questions. I'm not sure we'll be able to get to all of them, but one of them, just to follow on this litigation question, might not be one that you can answer, but do we have any idea how long it will take to resolve this litigation? And will it impede the implementation of the ETS? I think you said the ETS isn't scheduled to begin until January, in fact. What do you think is going to happen?
Well, in its brief today, OSHA said that this court, the Fifth Circuit, should not rule right now, that they should consolidate all the cases. And then there's like a lottery in which circuit should actually handle the cases and hear the cases. And they felt it all could be done by December.
Okay. Well, thank you for that. Now, we have a lot of different questions about different sectors and how the order might affect different kinds of workers. Let me just toss out a few of those and see what you think. One is, does OSHA cover office worker spacing and partitioning, HVAC performance specs, etc.? If not OSHA, do employers determine this on their own? Somebody else asked, how is this likely to affect workers in the hospitality industry, including hotels, restaurants, conference centers? And somebody else asked, what about schools? Are they impacted by this?
So schools are public schools, and they're not the private sector. Private schools with more than 100 employees are. My public schools is, they're not covered by the OSHA law unless you have a state plan OSHA, and then they're covered, and universities are covered. And in terms of, somebody asked about office workers. Yeah, this covers office workers. And in terms of spacing and partitioning, there are no requirements for that. The only requirement to protect office workers, unless you're in a hospital and then you're under the healthcare ETS. If you are an office worker in a hospital, or a laundry worker, or a janitorial worker, or whatever you are, you're covered under that first OSHA ETS. And so go on OSHA's website, www.osha.gov, and type in healthcare emergency temporary standard, and the whole webpage will come up and you'll see it. For office workers, all you have is this protection is the vaccine or testing. There are no OSHA didn't set a standard on HVAC performances for offices. They did for hospitals, but OSHA does have guidance that's really good on their website, and unions and workers can use this guidance to get, better protection. Yeah.
That's great. Somebody asks, when employers have to give up to 2 days to a worker to recover from the vaccine, is that paid time off?
Yes.
Okay.
Amazing, right? Yeah.
Really, like for so many workers who don't have paid
Right.
sick leave, it's a really important step, right?
Right, because I think a lot of what they heard is a lot of workers are not getting the vaccine because, one, they work 6 days a week and they have no time to get it. And second, they're scared if they missed a day or two of work from a side effect, they would get fired and they lose income. So this is really important.
Somebody asks, what would you suggest to state plans what should state plans do to create stronger regulation? Do you have any thoughts about that?
Yeah, well, we worked, when I was at the National Employment Law Project, a colleague of mine, Paul Son, who does a lot of the work with states, we really worked very hard with governors, willing to move forward with executive orders on COVID, and states. But if you're in a state OSHA plan, and that, like Virginia, OSHA issued, I mean, things have changed there now, but issued an emergency temporary standard, which was really one of the first in the country on COVID, that covered all workers. And California, Washington, Oregon, Nevada, Michigan, and then of course, New York is a federal state and issued regulation. New Jersey the governor issued regulation. So I think with a state plan state, I think you just start working with your OSHA agency to implement better protections. I mean, you can petition them, you can have meetings with the Department of Labor, if there is such a thing, in your state. So I really encourage, and also if you go to OSHA's website on their state plans, you can even pick up reports. OSHA has to evaluate every state plan every few years. The reports are called FAMES. I wish I remembered what it is, something about an evaluation of a state plan, but you can pick up the report and look at it and see what the deficiencies are in the state plan or what the strengths are, and sort of go from there.
Thanks, Debbie. Somebody else asked for clarification on agricultural workers. Are they covered by this?
Yes, they are covered. Maritime workers, construction workers. There is an exemption for workers that exclusively work outdoors.
Mm-hmm.
So we have to sort of figure that one out.
Okay.
But yes, it covers agriculture, and not very many standards cover agriculture. So
that's a very important step, it seems like, but also maritime, you said, as well.
yes, and construction. OSHA has like different standards. They have for general industry, which is really the category of everybody that's not included in construction, maritime, or agriculture.
Could you say some more about vaccination versus testing, and for workers who opt not to be vaccinated under this order, what's the protocol for them, and what are they required to do?
So I just want to make it clear that employers can put in a vaccine mandate under this standard and under the law. But they have to follow EEOC requirements. So that's for, there are exceptions for medical exceptions and religious exceptions that the EOC defines. But employers who don't want to put in a vaccine mandate can have a program that either you get vaccinated or you have to show me every week that you tested negative for COVID, and you have to pay for that test. And so you can go to the drugstore or go online and order all these tests, and you can't take it in your own house and then show it to me. You either have to let the employer see you do it, or you have to go to your pharmacist or your doctor once a week and say, can you just watch me take the test and sign here? Because so OSHA put some logistical hurdles here just to make sure that people are really submitting their own tests. And but it allows for testing, and it doesn't require companies pay for it, though I think some companies will, and some unions will negotiate for that, because in the end, companies want to keep COVID out of the workplace. And what better way to do that than test your workers? And in fact, one of my favorite occupational doctors, there's many, including Rosie and Bob Harrison, is Steve Markowitz from New York. And he said it should be twice a week. That's true. Companies should do it twice a week. I mean, really that, and get workers vaccinated. That's also encourage the vaccination.
But again, as you said, OSHA just sets a floor. Employers can ask for more and do more, right?
Right. I mean, OSHA could have required payment for testing. They could have required that if a worker gets COVID, that the company pays for them to stay home, but they didn't. And, OSHA should have did what they thought was the floor that would really significantly save lives. OSHA could always do more. I think, and but this is a minimum, and I think it'll have a tremendous impact. I wish OSHA had done something back in March and April of 2020, and maybe even March of 2021. But I do think that this will have a significant impact and will mitigate the spread of COVID in the workplace, which is really what this is about.
Great, thank you, Debbie. Somebody else asks a question which I think is really interesting and calls to mind the work of your former colleague at the Department of Labor, David Weil, who has done so much work on what he calls the fissured workplace and subcontracting, and the way that that's impacted our ability to enforce things. And the question is, does this order pertain to subcontracted workers? And so the implication of that, as I read it, is we're talking about employers of 100 or more. A lot of time you have subcontractors working in settings where the subcontractor might be fewer than 100, working in a setting of many more than 100. How's that going to work out? Do you have a sense?
In this case, in this standard, it's by employer. So if the subcontractor is the employer and they have less than 100, they're not covered. If the subcontractor has more than 100, they're covered by this standard. And let's look at temporary workers, talking about David Weil and the fissured workplace. The temporary workers, their employer is the staffing agency. So if the staffing agency has more than 100 employees at any time, they are covered. But if you're a temporary worker in a small factory that only has, or a factory that has 100 people and you're there, you are not, your employer is the temporary agency. So depending on how many workers they have, they may or may not be covered. I know OSHA also looked at franchisors and franchisees, and it's really by employer. So it's not by the franchisor like McDonald's. It's by the person who is the employer who pays the check, the franchisee. So the McDonald's may have more than 100 employees. If the specific franchisee does not, if they only have 50 or they only own 4 stores or whatever, they're not covered. And OSHA does say that they only covered that the 100-person cutoff was really based on what they thought was administrative feasibility for employers to implement, and that they will revisit, things for smaller employers. But again, smaller employers, they don't have to wait for OSHA to do anything to protect workers. They could be doing stuff right now, right?
Right. And when we're talking about an employer of 100 or more, it's not in any specific location, but if your total workforce is 100 or more, no matter how they might be dispersed, you're covered, right?
Yes.
Right. Okay. Somebody asks, and I think that this is a further reaction to the question of paid time off for people who do lose time overreaction to the shot. They're guaranteed to return to work, right? Is that part of that? I mean, inherent, it seems to me, in the idea that it should be paid time off. If you're giving them up to 2 days, the assumption is they get to come back to their job, right?
Oh, if those workers who are sick from taking the vaccine,
Hmm.
yes, yes.
And what about people who don't get vaccinated but come down with COVID? You said they can't come to work. What's the provision of what happens to them?
So I think, this is something that we're gonna have to see what happens. OSHA put some anti-retaliation language right in the standard, right after this provision, that
Right.
you can't discriminate against a worker for reporting that they have a work-related illnesses. And it could be that the company decides you didn't get COVID at work when you call in and you're sick with COVID. And so, we don't have to protect you, but it does say that they can't be, that you can't have sick workers and infected workers in the workplace. So I think that's something we're really going to have to look at and see. I remember at the beginning of the pandemic, there were a lot of employers, as soon as they heard someone got COVID, they fired people. I think that would be something OSHA would investigate immediately. If workers started being fired, that is something, I think that's the part of the standard that they would start going in immediately, saying what's happening here. So.
Mhm. Somebody asks about the hospitality industry and what impact do you think that the order is likely to have there, and any suggestions you might have?
Well, a lot of restaurants are below 100 employees. So hotels and conference centers, if they're above 100 employees, then they fall under this standard. Of course, I'm a big believer in layered mitigation until everybody's vaccinated, which, with turnover and everything can take a very long time. I believe everybody should be in a mask, especially at work, is why would you want to get sick when you're at work? And employers should keep employees safe, but, social distancing, masks, and of course, again, making sure that there's some kind of contact tracing. If a coworker gets sick, that so you can get tested. But if they're over 100 employees, they are covered. If not, then, you still want to maybe negotiate with an employer to give people paid time off to get their vaccine, let people get tested, let them pay for testing, give them masks.
On that point, somebody was asking about what tends to happen on OSHA regulations to the employers who are small enough not to be directly covered. What can we say from the history of OSHA in terms of when regulations come out and larger employers have to meet them? Does that tend to ripple out to affect workers elsewhere, and do other employers tend to try to move in that direction?
Well, this may be one of the first times that OSHA has exempted smaller employers.
I see.
Sometimes they exempt smaller employers from keeping certain records because it's too burdensome. And, in agriculture, every year on OSHA's appropriations, for some reason, any farm with less than 10 full-time employees is totally exempt from OSHA at all. So we'll have to wait and see. OSHA said clearly in the ETS that they're going to start looking at employers with less than 100. That's the next step. and, I think a lot of workers are not going back to work where they still feel unsafe. So this could go a long way to making workers feel safe. And I also know, just in my own life, people that are working for smaller employers, that once they heard OSHA is going to do this, they just started saying, let's test or get vaccinated. And so many people have gotten vaccinated. I mean, mandates do work. I know that, is a very vocal part of the world out there that's just totally anti-vaccine, but they do work in mitigating the spread of COVID, and they are safe.
Well, thank you. Debbie, I think one of the maybe it's a silver lining of this moment, this crisis, is that I can't think of a time when there's been more national discussion of safety in the workplace than has emerged around this crisis right now. And I wonder how, having spent 40 years, as you said, working on work like this, how you see this particular moment in the long struggle to try to make our workplaces safer. How do you see this moment?
It's actually a little bit scary, to be honest, because OSHA just issued probably what is the most controversial rule it ever issued. And OSHA during Ronald Reagan issued the rule that gave workers the right to know the chemicals they work with. It covered every employer in the country, big and small. And but because of the political or the politicization of science, and you have this fierce backlash against this teeny agency. That's all there is to protect workers. And, there is some concern that this could, get a whole bunch of, Trump appointed judges or judges that just see things really differently than what the law says, and, get this up to a Supreme Court who ends up sort of ruling that, well, maybe federal agencies can't really do this. And then workers will have nothing. So it's very scary time, but I'm glad that OSHA issued the emergency standard for healthcare workers. I'm, glad that they issued this. And I hope this does. And I want people to also know, I didn't talk about it and I apologize, but for another webinar, is the Centers for Medicare and Medicaid Services also issued a regulation for anybody that gets funding from them. There has to be a vaccine mandate. So that, with the federal contractor mandates, I think they'll all go a long way, I think, to making us all safer at work.
Debbie, what gives you the most hope at this moment? As you rightly point out, this is a really a kind of a tenuous moment as we try to figure out whether we can develop a consensus to protect workers around this central threat. Where do you get the most hope at this moment as you think about it?
Well, I get a lot of hope by there are so many groups now that are active in worker safety that were never before, that never really thought about it. I think people are very aware of how weak worker safety rights are. And I think this is a time when workers who have been out there, our essential workers, our frontline workers, are realizing that they really did sacrifice their health and their lives for the rest of us, and that they are, demanding that, some recognition of this. And that gives me hope. I think it's great that OSHA issued a standard for healthcare workers that required payment if they get sick. I think it's great that OSHA issued a standard that employers have to pay for someone to get the vaccine, and if there's any side effect, those are all huge things. And OSHA just got a new director, Doug Parker, who started Wednesday, right before the standard was issued. And I think he'll be great. And so that gives me a lot of hope as well. And of course, our Secretary of Labor and our president. So
talk about a baptism by fire. He really stepped right into it, right? Well, Debbie, I think many of the people on this call would say that you really give us hope. You've been such a clarion voice, calling attention to this threat and to really to the whole issue of worker safety and health over many years. And we're really grateful to you for taking the time to be with us tonight and to share these answers. We'll, those of you who are listening will pledge to do this again as we see how this plays out. In the meantime, keep in touch with us. And thank you very much, Debbie.
Yes, thank you all for spending an hour with us. Thank you.